May is Mental Health Month, and we are continuing our series looking at issues that might not be in the forefront as the fight for our physical health is taken center stage. But as many people face extreme circumstances, including traumatic experiences, depression and suicide have come into sharp focus. President Trump referenced the issue last week while talking about reopening.
You know, if they held people any longer with the shutdowns, and you're going to lose people that way, too. And you already have, I'm sure. But between drug abuse and, I mean, they say suicide, a lot of different things. There's no win.
Currently, there is no documented epidemic of suicide, but there is great concern among mental health professionals about the overall effects of the pandemic. Our Will Carr has more on the struggles many Americans are facing right now and what can be done to help.
Across the country, millions are struggling with our new reality.
I think in waves, the reality of what's happening hits me, and the uncertainty and the scale of it, I think, is really hard to hold for a continued period of time.
The hardest challenge and one of the first kind of waves that impacted my mental health was just the homesickness.
For a couple of days, you'll be okay, especially if you can go outside and spend some time. But if like a day like yesterday happens where it's raining, then you kind of get sad and you're stuck indoors and don't really feel like you have any space to yourself anymore.
At any moment, I could be holding a COVID patient while we're cleaning them, and just inches away from me, they're coughing. So it's pretty unnerving at times.
After Paul Krieg witnessed 9/11, he decided to change careers several times. He just graduated from nursing school and started helping COVID-19 patients on his first day on the job.
I find myself on breaks, trying to relax, maybe take a nap, and I can't. And even when I come home, I'm working the night shift, and I find it very hard because of the patients that I've seen in dire distress, and also hoping that I don't bring this home to my wife and to my child. And what happens if one of us gets sick? What happens if both of us get sick? Who's going to take care of our child?
Last month, Lorna Breen, who was on the front lines as the chair of the emergency medicine department at New York Presbyterian Hospital, took her own life.
I fear that we're going to see a lot of post-traumatic stress disorder. There are many doctors, even seasoned doctors, who have seen more deaths in the last month than they had seen in their entire careers before that. And that's got to take a toll.
Mental Health America, a nonprofit, says nearly 20,000 people have come to them with anxiety and depression directly linked to the pandemic.
In our April screening for depression, we had more than 7,000 people tell us that they regularly are having thoughts of self-harm or suicide, and that's twice as many as we would get in a normal month.
And even though younger groups are generally least affected when it comes to their physical health, experts say that's not what they're seeing when it comes to mental health.
We've seen an inverse relationship between the age of a person and how deeply this is affecting their anxiety or depression. In other words, the younger people are feeling it a lot more than the older people are.
Calls to the National Disaster Distress Helpline have spiked, according to Dr. John Draper.
It's like a big boulder is sitting on top of them, and they feel hopeless and helpless, and they can't push this thing up. But that boulder is really a lot of smaller rocks that are piled onto each other. So if you can just focus on one thing that seems achievable that you can address in that moment, you can't deal with a whole boulder, but you can deal with that rock. And as you deal with each rock and you remove some of the pressure, you begin to feel like you're more in control.
A few months back, before all this started, the idea of working from home for a day or two might have seemed really attractive to most of us. Right now, after several months of it, and often being enclosed with whether it's housemates, whether it's family, whether it's children, it's really complicated and really tough to stay happy, healthy, well, and productive and focused at this time.
That's why Headspace, a popular meditation app, teamed up with hospitals and the cities of New York and Los Angeles to offer free guided meditations.
We saw across some of the anxiety and stress content in particular, we saw spikes of over 1,000%.
That spike, though, is leaving many mental health experts concerned about how long this anxiety will pulse through the veins of our communities.
we're not going to have a one and done wave of mental health problems. We've got mental health problems that are sinking in right now and are going to keep building over a period of weeks and months to come as grief increases and as financial problems increase for people.
Things change a little bit every day, but not a lot. So make sure that you give a lot of time to focusing on activities and not a whole lot of time taking in all this information, which is filled with a lot of speculation these days.
And Will Carr joins us now live. Will, really important story to tell. So many of us have had our worlds turned upside down recently, but it's also important to note depression is not just sadness, it's a disease. And curious to ask you, after talking with experts in that field, what do they say is making things most difficult right now? And what are some of the things that they say can be done to help?
Well, Lindsay, you heard Andy from Headspace say there that this is complicated. They say that one of the biggest things that people are dealing with is just being alone, being isolated right now. Millions of people across the country are cut off from their friends, their families, and their jobs. They're also worried about underlying issues that people have if they had before, like drinking or using drugs. And some of the things you can do to combat this, obviously, are you go get some exercise, even if you have to do it in your apartment or your house. You can meditate like you saw in the piece. And one doctor pointed out something really important that I thought. He mentioned that there's a bit of a stigma with the word, the term social distancing, and that we need more physical distancing, 6 feet or more, but being social is exactly what we do need. So you can call somebody, you can get on a video chat, and even if you don't need that right now, you can guarantee that somebody else does. Lindsay.
Right, physical distancing, not social distancing. Will Carr, thanks so much for that tonight. And a reminder to please, if you or someone you know is thinking about harming themselves, please call the National Suicide Lifeline for help right now and know that you are not alone.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.